Hello. Hello, everybody, and thank you for attending today's Dice Grant Brown Bag Series. I got confused there. The Brown Bag Series. And today I have great pleasure of, first of all, let me do some housekeeping, I forgot. The attendance sheet will be passed around. Please sign in and hand it off to the next person. The QR code of the evaluation survey will be displayed near the end of the presentation. You must fill it out in order to receive CEU and CME credits. We will be presenting until about 10:45, 10:50, at which time we'll take questions and answers. Please hold off on asking any questions until then. We will have the microphone down here and we'll pass it around to anybody who raises their hand, and we'll also take questions from the folks online. Today it gives me great pleasure to introduce to you Mr. Julio Jordan from the Ibero-American Action League. And Ibero-American Action League is near and dear to me because really they were my first sponsors in starting Lazos Fuertes, and they have been great collaborators of the Department of Psychiatry and URMC at large. So we really thank Julio for coming here and offering this lecture. Julio Jordan is the Director of Diversity, Equity, Justice, and Inclusion at the Ibero-American Action League. He collaborates with corporations, organizations, and health providers to advance DEI initiatives. Julio holds DEI certificates from Cornell and Muma College of Business at the University of South Florida. He was nominated for the Rochester Business Journal's inaugural Colors of Success DEI Award and received special recognition from Monroe County Executive Adam Bello for his dedication to the Latino community. And I couldn't be happier than to welcome Julio to give us this lecture on Latino voices, unheard and silenced.
Thank you. I got to start off by saying, I'm just a kid from the South Bronx. So to be standing here in front of all of you today is a great honor and a great privilege. So I thank all of you. And I'm hoping that at the end of this presentation that you'll have information that not only will prove valuable to the work that you do, but will also impact the work that you do moving forward. So let me start off by saying, I want to definitely thank Dr. Olivares. I see Dr. Cupertino here, Chanel Anderson, URMC, most importantly, all of you that are here present in the room and all of you that are on Zoom. As was mentioned, my name is Julio Jordan, and I am the Director of Diversity, Equity, Justice, and Inclusion for Ibero-American Action League. I am also the chair for the Latino Health Coalition, which is run through Common Ground Health. This report that I am going to be discussing today is a report that was put together by Common Ground Health. I will make sure that you all have access to the online copies of this, so that way you can review it as well. Today I'm excited to present on a critical topic and report that we put together. It is titled How Silencing Latino Voices Harms Latino Health Equity. Our discussion today will delve into the profound effects that the marginalization and silencing of Black and Brown voices have on the health outcomes of our community. The data we will explore represents human lives, and it is meant to be used as a tool to guide and enhance the incredible work that you are all already doing. I am one of those many faces of this data, and the thing I love about data is that data gives us a lot of insight, gives us a lot of numbers, but without faces behind that data, I don't think that it holds as much weight. So when I'm talking about a lot of these things that I will be talking about, I am a representation of that, growing up in a single family household, who was the person that was there for my father when he was experiencing health issues. I was normally the interpreter. I was normally the point person, because he did not speak English, and a lot of times the care that was provided to him was not provided and culturally relevant. language. So even though doctors or providers were able to speak Spanish or provide Spanish, it really wasn't from a cultural lens that made sense for my father. So as he found out that he was diagnosed with life-threatening illnesses and diseases, I found out before he did and had to relay that to him. So I don't think any child should have to endure that. And that's a lot of what we're going to talk about today. One of the things that I do want to talk about briefly before I get into the report is up to 60% of your health is determined solely by your zip code. Your zip code determines your health outcomes. This is largely due to the nature of the communities people reside in, such as whether it has wealth, whether or not there is strong community investment, and whether hospitals and health centers are present, amongst others. Your social and built environment determines your individual health and community health above personal behavior and clinical care. I'll admit I don't have all the answers, but I believe that together we can make a positive impact on the health of the communities that we all serve. Your dedication to health equity is vital, especially these last 4 years, which have been very challenging. So I applaud and I commend each and every one of you for helping us get through one of the worst pandemics of our lifetimes. So I want to thank you for your commitment, and we will move forward. So Unheard, Ignorado. These are two other reports that we put out previously. Overloaded, which is the heavy toll of poverty on our region's health, and The Color of Health. Both of these are also available on the website, and I will make sure that that you have that information. 4 years ago, we started the conversation in the region about poverty, culminating in the Health Equity Report, which was Overloaded. In that report, we learned that it didn't matter if you lived in a city or if you lived in a rural area. If you are poor, you have a harder time maintaining good health. In fact, if you are poor, poverty may be killing you. 2 years ago, we released The Color of Health, where we showed that poverty doesn't explain away all health inequities. Racism is killing our Black brothers and sisters, no matter what their income is. And as the pandemic intervened in our work, we spent time writing and rewriting the Latino report to make sure that it both reflected the pandemic and the world after the pandemic. So quite frankly, we know that it's pretty terrible out there. I see it day in and day out. My office is located on North Clinton Avenue, outside of the Father Tracy Center and the St. Michael's Church, right in the heart of North Clinton Avenue, 14621. 1 million Americans have died over the past 4 years, loved ones that we all knew. Economies have collapsed. People have been displaced by wars, dictatorships, floods, fires, and as we know, we're still living in a very touchy climate with upcoming elections. No wonder people have been flocking to the Finger Lakes region to escape a lot of the things that they've been going through. Most recently, Venezuelan asylum seekers who have been coming to the Finger Lakes in the Rochester area specifically to flee the hardships that they're experiencing in their own countries. Using the voices and experiences of Latinos, our new report, Unheard, Ignorado, tells the concerning story of this region's new and longtime Latino residents and their struggles with trying to achieve health equity. The concerns voiced by the area's fast-growing Latino community have gone unheard, leading to health inequities. One of the things I like to point out about the report is that we purposely, when we put it together, made it in English, but if you flip it, it's in Spanish as well. We want to make sure language access, which is crucial to the information that we receive, is available. I remember when the pandemic first started, and I remember when we were in the testing phases, being over at Franklin High School over on Norton in the city. And we were giving and providing individuals with registration forms so that they can give us information on how to contact them once these results were found. And as all you remember, the very beginning, we didn't know what was going on. We didn't have all the information. What really stood out to me is that this form was only available in English. And when I flipped it over, there was a blank side that wasn't utilized. And I remember at the time, I asked the county and the city, did anyone put any thought into just translating it and using the other side? so that Spanish speakers had access to the information and were able to provide the information. So this alarmed me, and thankfully it was rectified. But these are things in 2024 and 2020 we should not have to request. And that's what this report really focuses on. So the Latino population of the Finger Lakes region, if we look at it in the year 2000, 49,173. In the year 2010, 68,180. In the year 2020, 93,119. So if we look at that, we're looking at about a 20 to 30,000 person increase over 10 years. So I will speculate that by 2030, we will be close to 125,000 Latinos in our Finger Lakes region. On average, Latinos are more likely to live in poverty 3 times when we look at our white counterparts. Latino residents are younger and have fewer resources than other residents of the Finger Lakes region. Our data shows that Latinos are 3 times more likely to live in poverty. Poverty and lack of insurance leads to a lack of access to health care and health inequities. Quite simply, poverty kills. So why do we see such poverty? You know, one of the reasons is that Latinos earn less than white adults, no matter what the educational level is. So here we have, and once again, statistics, numbers. Here we have individuals in gray that are white non-Latino adults and in green Latino adults. And we see here that all the way across up to bachelor's degrees, there is still a discrepancy and there is still a difference in pay equity. And we have to question, why is that? When we look at Latino adults having more likely to have challenges accessing healthcare, we know that we face worse outcomes for diabetes, high blood pressure, colorectal cancer when compared to white non-Latino patients with these same conditions. As you can see here, Latino adults are less likely to get needed medications, less likely to have a relationship with a primary care doctor, and more likely to have visited the emergency department in the past year. And I'll use myself and my father as an example. Unless he felt like he was dying, he would not go to the hospital. He would not go to the doctor. He always felt like it was a waste of his time because when he went, he never felt like he was being treated with the respect. He was never being greeted in a culturally responsive manner that really made him feel welcomed. And if you don't feel welcomed, why would you keep returning somewhere that you don't feel safe? And that was our experiences. So this is something that we want to make sure when we look at it. And once again, I like to emphasize the fact that just because something is translated in Spanish doesn't mean that as a Puerto Rican male, that I am going to read it the same as someone who's coming from Mexico or Venezuela or from Spain. There's cultural nuances, there's cultural differences that we have to make sure that we are really incorporating within the care that we're providing. And I will say that in Rochester, the Finger Lakes region, a large percentage is Puerto Rican. But as I mentioned previously, we have a lot of Venezuelans that are coming here seeking asylum. We have a large seasonal Mexican population as well as Dominican and Cuban. So we do have a lot of representation from various Latino cultures that needs to be represented and spoken to. Latino adults are more likely to be hospitalized for hypertension than white non-Latinos. Because of poverty and lack of access to health care, have worse outcomes for those diseases that I previously mentioned. And a lot of times we're more likely to be hospitalized for preventable complications, once again, because we wait until the last minute. But instead of asking the question of why are we waiting to the last minute, we really have to ask ourselves, what is stopping us from getting that care that can prevent it and not have to wait to the last minute? While Latino adults have diabetes at greater rates than white non-Latino adults, they are still much more likely to be hospitalized for preventable complications because of it. These are questions that we have to ask ourselves, and I ask myself every day as I fight for health equity. I am a champion of the class standards, which is the culturally and linguistically appropriate services, and ensuring that people are being provided the care in a culturally responsive manner, that we are meeting people where they are, not where we are. Latinos lose more years of life to colorectal cancer than white non-Latinos, despite a lower incidence rate. This is the new face of the region, and our data needs to reflect that. We have several calls to action, and that's one of the things that I truly appreciate about this report, because information without directive or information without a call to action, to me, is not really as valuable. So we do have calls to action, and I'll review these towards the end of the presentation as well. But one of the calls to actions in the report is to promote better data collection methodologies of ethnicity data. If you truly don't have a pulse on the people that you serve, then who do you know, or how do you know who you represent? For me, more importantly, how do you ensure that from an internal standpoint, that the representation of those communities that you serve are also being represented? And one of the things for me and the work that I do day in and day out is I take a look at the board, I take a look at executive leadership, and if they don't reflect the communities that you serve, you need to ask yourself why. Why not have those individuals at the table? Why not have those differences and those cultural experiences present in the decision-making that ultimately impacts those communities? So collecting that data and having that information is crucial to the work that we do. One of the reasons why Latinos have worse outcomes is that far too often key health information is not available in Spanish. Once again, culturally relevant language, but also in language that meets people where they are. You are all blessed, and the education that you have gone through to get to where you are, I can't even fathom. But not everyone understands the terminology, not everyone understands the language that you were taught. So a lot of times when information is being conveyed, we have to make sure that we're speaking to individuals in language that they understand, not that we easily understand. It reminds me of when I used to work in corporate America for a telecommunications company, and explaining to people, one of the things that I always remembered and stood out is avoid using jargon or avoid using language that we know, but instead speak the language that they know. During the pandemic, the Latino Health Coalition called for information about COVID to be translated into Spanish. I gave you my own personal experience as well. And this would seem simple, but too often it wasn't happening. The result was that many of the Latinos, especially those working frontline essential worker jobs, were hurt the most. During the first 18 months of the pandemic, Latino patients were hospitalized because of COVID-19 at nearly 3 times the rate. At number 3 stands out a lot as we look at a lot of these statistics. They died at 2 times the rate of white non-Latino patients in those first 18 months. We know that's a tragedy, and that health inequity could have been prevented with better frontline precautions and better translation and interpretation for individuals. And I remember, even when we talk about language access, I remember, information that was being conveyed by our then governor that wasn't being conveyed in sign language, for those individuals. And we know that Rochester has a large population of deaf and hard of hearing individuals. And this was an afterthought even for that population as well. So things to really think about as to why this is an afterthought and not being thought of. And one of the reasons why I personally believe that is because those individuals are not sitting at those tables, and the individuals that are making those decisions don't reflect those communities enough to be able to have a voice for them. While life expectancy at birth dropped for everyone during the pandemic, we saw the biggest drop for Latino and Black non-Latino populations. So if we look at the drop in life expectancy, once again, I always use the phrase, and it's cliche to say men lie, women lie. Numbers don't lie. Those are numbers, don't lie. They really don't. Another call to action, we can't go back to a time before COVID, we know that. I think that we've been strengthened as a result of it. We persevered and we're continuing to, but we need to learn the lessons from the pandemic. We need to promote health equity by making sure everyone's needs are met, no matter what language they speak. The report calls for us to develop and assess all health improvement interventions to ensure accessibility, adoption, and impact for the Latino community so that we are not an afterthought. We should make important health information just as readily available in Spanish as they are in English. And honestly, I would go further than that. The languages spoken in our community. We have refugees that come from all over the world and settle here in Rochester, New York, in the Finger Lakes region. And we have to make sure that everyone has the accessibility to the information in the language that they prefer. I like to joke sometimes that, me being able to switch from English y hablar español without even thinking about it is a superpower. But if I can speak English and I prefer to read something in Spanish, I should have that readily available to me. It shouldn't be that, well, you speak English very well, why doesn't that suffice? It shouldn't be that way. The report outlines how Latinos' needs have been ignored due to a lack of bilingual healthcare workers and culturally responsive healthcare. It traces how Latinos' trust in the medical system has been eroded by medical atrocities, such as the tens of thousands of Latina women who were forcefully sterilized over these decades in our nation. And these are things that I would definitely encourage you as you progress and you grow through your educational journey and your own professional journey to really educate yourself as to why a lot of individuals don't like to see their primary care doctors or don't want to. We got to think about those things that didn't happen hundreds of years ago, that literally happened within the last few decades. It's just as important in rural areas to make sure that information and interventions are tailored for the Latino community as it is in urban areas. That when I think of the word tailored, I think of being able to go to Adrian Jules or being able to go to a fancy dressmaker and having them make that suit or that dress specific to you. Why can't healthcare be the same exact way? That's what we really want to make sure and emphasize, and that's what this report emphasizes. Every day in the Finger Lakes, there are people who are struggling with health conditions that are made worse when they cannot understand what providers and specialists are saying to them about their health. My dad always used to shake his head yes, and never understood one word that the doctor was saying to him. But he would say yes because pride fueled that, because he didn't want to feel like he was less than, or that because the doctor said the thing or whatever it was over and over again, my dad didn't want to be made feel like he was dumb. Now, I will tell you, my dad had a second grade education. My dad dropped out of school in the second grade to work the farms and to provide for his siblings. So just because someone nods their head yes, or that they say, I speak a little English, that's not enough. That is not enough. And that's leading to worse health outcomes, because that yes was really a no, but he didn't know any better. And the doctor or the provider assumed, well, he shook his head. That meant yes to me. Providers need to make a special effort to make sure they are understanding and being understood. Building relationships and trust is a key step that providers can take to improve health equity. Additionally, the report calls for working with employers and creating employment policies that treat workers fairly, regardless of their citizenship status. We know that we have individuals that are coming from all over. I hear it a lot where individuals say they're coming from other countries and they're taking our jobs. No, they're coming from other countries and they're doing the work that a lot of times we don't want to do, that is crucial for a lot of us to continue to do the work that we do. Putting those fruits and vegetables on our tables is hard work, but we don't think about that when we bite into that apple or we eat that, sweet corn on the cob with our dinner. That's crucial work that impacts all of us. The lack of language access, culturally responsive healthcare, and bilingual healthcare workers shows that Latinos' needs have been ignored. One way we can work to pay more attention to those needs is to recruit more Latino healthcare workers. Right before I started this presentation, myself and Dr. Olivares, Dr. Cupertino, we're talking about the fact that, as we progress in our careers, our responsibility is to pull others. But I challenge everyone to do the same. Why isn't there a bigger representation? What are we doing to make sure that the pipelines are being not only opened, but are not being clogged by policies, by obstacles, or by resources that could have otherwise pushed more individuals, specifically Latinos, into those positions? Here we see that 18% of the working population is Latino, yet the representation, when we look across healthcare fields, is not there. And one of the things that I always stress, and I always challenge individuals to look at, is what culture are you providing within your space, within your community, within your own profession that invites and is welcoming to those individuals? Because that's important. One of the things that we pride ourselves as Latinos is respect for one another. If you've ever been to any country, Latin American, Caribbean country, it could be a stranger and they offer you a cup of coffee. They welcome you into their house. No questions. That's the culture that we are. So we want to make sure that professions, institutions, organizations are equally as inviting, with a cup of coffee waiting for us, with a smile, saying, welcome, we want you here. Those are things to think about. And this process starts by recruiting more students into healthcare educational programs. I'm happy to say that Dr. Cupertino, myself, and others are working towards that, to making sure that from as early as middle and high school, individuals are already thinking about healthcare professions and are being led into those positions, those individuals that reflect the communities that we all serve. Another call to action is calling for the healthcare community to promote policies to ensure the hiring of more Latino doctors and healthcare professionals. This is essential for us to provide proper patient care. We have some of the greatest institutions, University of Rochester, Rochester Institute of Technology, where I just went on vacation and saw someone proudly wearing a RIT shirt. I've seen people proudly wearing University of Rochester shirts. The thing about it is we don't only want to educate individuals, we want individuals to stay here and to strengthen our communities and to ensure that more individuals from the same district that I graduated from, which is the Rochester City School District, are going into these institutions and are being welcomed and are having the resources necessary. Because a lot of times resources is what really prevents us. It's not the will, the lack of will. It's not the lack of knowledge or the lack of determinants or passion or perseverance. Sometimes it's the lack of funding and the lack of resources that prevents us from being able to do this. So we want to make sure that those opportunities are there for everyone. I mentioned earlier that my office is located over on North Clinton Avenue, right across the street from St. Michael's Church, which is the pillar of the Latino community. The late Father Tracy was the champion of the Latino community here in Rochester, New York. The International Plaza, which is across from my office, is now a welcoming venue that invites people from all backgrounds to really become enriched and learn and educate themselves in our culture. And I welcome and challenge each and every one of you in the room and everyone on this Zoom call to stop by, have an empanada, have a cup of coffee. This Sunday, and I'm gonna do a shameless plug, is the Dominican Day Festival. Come down and celebrate the Dominican culture. See the music, see the smile on everyone's faces, and change the narrative that has for so long really decimated and has a negative effect on the communities that we serve and that we are a part of. On La Avenida, Latinos have found opportunity and community, but it is also a neighborhood that has been harmed by redlining and epidemics such as the opioid My father was one of those that was impacted by that epidemic. Latino residents have to deal with the impact of the region's drug epidemic in their neighborhood on a daily basis. Many of those using are not even Latino, but they are those that use those drugs just as soon as they purchase them in front yards and backyards, no matter who is around them. Our neighbors have responded with initiatives like No Mas, but the overdoses and the needles keep piling up. And the International Plaza, which I just mentioned, was one of those places that for many years, I think it took almost 40 years for that to be turned into a lot that was filled with empty beer bottles and empty liquor containers and tons of needles. I remember going out and collecting needles, and we had buckets full of needles that were discarded in the same exact playgrounds, in the same exact lots that our children play in. That's unacceptable. And I'm glad that we have finally made progress, but we have so much more to go. And all of these things impact our health, right? Food deserts, redlining, as mentioned earlier, the zip code that we live in, all of these things impact. Growing up, I'm blessed to have lived in Rochester and raised my children here in Rochester since 1993. But prior to that, I lived in the South Bronx. And the thing that stuck out to me is that the similarities were there. The neighborhood that I lived in the South Bronx wasn't that much different than the neighborhood I lived in off of Lyle Avenue and off of North Clinton Avenue. Access to food that was healthy, access to resources that was healthy, wasn't present here as it wasn't present there and other places that I visited. So when we look at that, we have to think, is that a coincidence? I don't think so. I don't think so. We can see here that drug overdoses jumped from a decade ago to now. They are the top cause of premature death for Latinos in the region. And they are also a leading cause of premature death for Black non-Latino adults and white non-Latino adults. So here we look at how much it's jumped. And this is the years of potential life lost per 100,000 population. Those numbers are alarming. And once again, I always say that although myself, I was never a drug user. I never fell I can't say I never fell victim to drug abuse because I lived with a parent that was. So I got to see it from a sober lens while he was medicated. So those are things that really, when I look at these statistics and I look at drug overdoses and having to be a child that saves a parent from an overdose, that shouldn't be the case. And we have to think, what can we do respectively in our own professions to ensure that everyone has access to treatment? Because contrary to popular belief, people that overdose on drugs did not choose that lifestyle. No one wakes up and says, hey, today I want to overdose. So we have to figure out, how do we treat, once again, culturally relevant treatment? This outdoor drug use and neighborhood crime near the North Clinton Avenue takes a toll on our families and especially on our children. Our kids are reporting mental health issues and adverse childhood experiences far too often. I remember the first time that I took an adverse childhood experience, ACE exam. I found out about it as I was working in this profession. This is one of those tests that I was so saddened and so hurt that I got every question right. I wasn't expecting that, and I wasn't expecting to be where I was. And based off of the ACEs, I should be a drug user, drug abuser, obese, cigarette smoker, incarcerated, or dead. And today, here I am standing in a room talking to all of you. So that's to show you that with some direction, some resources, some education, and someone to put their hand on my shoulder and say, you know what, I'm gonna help you get through this. Empathy, not sympathy. It's too far often we feel sorry for individuals when we see on the news that these people were impacted and we say, oh, we feel so sorry for them. But where's the empathy? Where is the, I am going to go out there and help this individual and put my arm and embrace them? Those things are important, or even more important. A lack of bilingual mental health providers is a crisis that needs additional investment for treatment, for preventative care. When I'm in a space where I can relate to the individual, where I see myself in that individual, where I can talk to that individual as we greeted each other today. Dr. Olivares, Dr. Cupertino, hola, ¿cómo está? Just that simple. We speak English, but we choose and we embrace, we hug. Hi, how are you? Those cultural nuances and those cultural differences make such a huge impact. Now, I'm not saying go out there and hug everyone, especially in a post-COVID world. We want to still respect those boundaries, but the principle and the idea and the ideology behind it, to me, is crucial, that we really do embrace individuals, we welcome individuals, and we provide them that cup of coffee. And that we also bring others into the space so that that way they have people that can relate to them. It makes that interaction and that relationship so much more strengthened by that gesture. We see all these numbers, and in our community, you know, mental health is something that even myself growing up, I was always afraid to talk about that because I would be classified as crazy, or even worse, that I needed to man up, that I needed to be stronger, that crying was a sign of weakness. Those are things that I saw growing up. And now, as a parent, now as an adult, I say, no, you know what? That's actually a sign of strength. We need to make sure that we normalize that. And I'm working towards doing that. So I ask, what are you all going to do to normalize that as well? There is a severe shortage of all bilingual providers throughout our area. The shortage is especially severe with bilingual mental health providers. No one wants to have an interpreter in the room when they are sharing with therapists. We must train and support bilingual mental health professionals, and we need them soon. Another shameless plug is community health workers. Ibero does a great job of really educating and creating a program that encourages and provides community health workers with the resources that they need to go out there into our communities and serve those individuals that speak, look, and act like them. That culturally responsive treatment is so important. We also need to address behavioral health conditions that are sending Latinos to the emergency departments at rates higher than their white non-Latino counterparts. Once again, my father would wait until the very end before he decided to go, and usually the very end meant he was in the emergency room. Before he passed away in 2015, you know, we used to joke that his idea of taking a vacation was the monthly visits to the ER room, and then he would be hospitalized for 3 or 4 days. And that was vacation for him because he got to not have to worry about anything but just lay in the bed. That's not my idea of a vacation. Another call to action is for the community to address mental health concerns expressed by the Latino community and engage mental health and substance use recovery providers in dialogue with the Latino community about mental health, substance use disorder, and their impact on patient health and their families. We need this to ensure that our families and our community are healthy and strong. I'm always grateful when we do initiatives like No Mas, which is basically a human chain where we shut down the drug operations on North Clinton Avenue, if even for an hour or two. We shut it down and we ensure that the community knows that we're here. I love when we do neighborhood cleanups and individuals from other cultures and other backgrounds and other communities come in and help. But what I love even more is when those same individuals actually ask, what do you need from me? Instead of telling us, this is what you need from me, right? Asking and telling are two different things. So we want to make sure that those individuals are being not only brought to the table, but that they're being given a voice at the table. What's the sense of having individuals at a table if they're not allowed to talk and speak and provide their own experiences, regardless of educational background, regardless of their zip code, regardless of what they look like, regardless of what language they speak? If you haven't seen your work reflected in a call to action yet, know that this one is for you. Everyone in every job has a role to play in making sure that language and cultural competence is ensured for all neighbors. This goes for Latinos and all who come from cultures other than your own. Everyone can contribute to this call of action, and that's standardizing the criteria for language access and cultural competence that every agency can follow as minimum requirements beyond federal laws and obligations. A lot of times we say, well, we're adhering to the law, we're adhering to the regulations set forth, but we are adhering to the communities and the human beings that we serve. That to me is more important. Don't just do the bare minimum. You always want to go above and beyond that. So once again, these are the calls to action as we get to the last few minutes of the presentation, and then we'll definitely turn it over to questions. I thank everyone on the Zoom call. I don't want you to think that I'm ignoring you, and I thank all of you in the room for being here. But these are the calls to action recapped. We invite everyone to download the report, read it, and consider how it applies to your life and your work and what impact you can make on it, right? We don't need to take every single thing and do, but if we all do one little thing, collectively, we would have made a huge difference and a huge impact in the communities that we serve. On the screen are those calls to actions repeated again. We can make a difference in people's lives if we all collectively address these calls to action. The report outlines how health inequities, such as these stem from Latinos being ignored, silenced, and marginalized. For too long, our concerns have been silenced. This report helps ensure people are listening when we call for change. The Latino Health Coalition was integral in building these calls to actions. And as I mentioned earlier, I am the chair of the Latino Health Coalition. I invite any and every of you to join alongside us, to fight alongside us for health equity. This is open to any and everyone, whether you're a professional, whether you are a community stakeholder, a student, regardless of your background, regardless of your zip code. We welcome everyone, because with everyone at the table, we can make a lot of those changes and impacts to these calls to action. And these are just a recap of all of the calls to action that we had. They're also contained within the report. They're also downloadable and available on the Common Ground Health website, as well as other crucial reports and crucial data. This is a picture of the Latino Health Coalition. These are individuals that come from all diverse backgrounds that really just come together to really strengthen, educate, provide resources for, and fight on behalf of the communities that we serve. This is where you can find the report. Once again, I'll make sure that you have the resources, that you have the link to the report. The way that I'm doing this presentation now, I am more than happy to do so in your respective offices, churches, wherever this information can be shared that will leave an impact and have individuals walk away with something that is going to better the community. I am willing, and we're willing to do that. We also have the Latinx Roundtable, which is a group of leaders who have come together to really advocate on behalf of the communities that we serve. When we look at Ibero-American Action League, we have been around since the late 60s and were created because there was no representation or advocacy being done on behalf of Latinos, even though the population was a huge part of the community. We work here, we live here, we play here, we spend our money here, we raise our families here. So we want to make sure that everything that we do impacts the work that is being done here. So I definitely want to make sure that that is there as well. and we are available, and you are all welcomed to be a part of not only the Latino Health Coalition, but the Latinx Leaders Roundtable. And with that, I will turn it over to Dr. Olivares. Thank you.
Thank you. Thank you very much, Julio. That was very, very interesting, and I hope you filled a big void that I think we all have about, and misconceptions really, about the Latino community in this, in our Rochester community, and the people that we serve here day in and day out. So thank you so much for that. I will add that we have taken one of your call to action points, and we, as an institution, are going to be working along with Dr. Cupertino and myself on a language access strategic plan for the entire medical center that we hope will impact or begin to impact health equity. Because really, a language access is all about health equity. So any questions from the audience for Julio?
And also for everyone on Zoom, we will be monitoring that, so go ahead.
Hello. Thank you for that presentation. I'm very curious to know if you considered any part of South America or Brazilians or Portuguese speakers part of this report.
Well, yes, this is language access for everyone, not only those that live in the Americas, Caribbean, and other continents, but individuals that are coming from so many different places. We have refugees that are coming to Rochester from parts of South Africa, from everywhere. So we want to make sure that language access is provided to everyone. Now, this report specifically speaks to Latinos, and that encompasses everyone from a Latin American country. So including Brazil, Portuguese, or any countries that are derived from Latin. Yes. I hope that answers your question. And I hope that the calls to action reflects the encouragement to ensure that all communities are being represented as well.
A lot of it does have to do, with like Spanish, things that are in Spanish. It might not be available in Portuguese, despite, Brazil being so massive. So it was just very interesting to see that it seems almost as though, in a way, that's kind of the course, the path is going more like towards Spanish and Spanish-speaking countries as opposed to the Brazilian/Portuguese Spanish speakers.
No, absolutely, and I definitely appreciate that. When I tend to talk or represent, I try to speak from a sense of where I'm coming from, the perspective of the communities here in Rochester. While yes, those are important and crucial, it's also a fact that about 90% of the Latinos in the Rochester area are Puerto Rican, such as myself. And I think that not only we as Latinos, but everyone's culture and everyone's language should be accessible and should have the benefit of being able to read something in their preferred language, regardless of where you come from, to be honest.
Yeah. And that's part of the class standards and what we will adhere to here at URMC. While we're focusing on Spanish language today, when we talk about language access at URMC, it's about the principal language access that we're dealing with is Spanish, but we're creating pathways that really can be replicated in any language, and that the resources will be there for any language. So hopefully that answers some of your questions. I do think that there is a lot of errors in statistics because we keep confusing things, right? We kind of talk about language, we talk about Latinos. Well, I can be a Latino that doesn't speak Spanish, right? So we kind of confuse terms, and then we throw in their race. And I think a lot of the misconceptions in a lot of our data is that we're always taking out Latinos. We look at black and white and others, and we don't really know where Latinos are, any of us. And I think that that's something that the OMB is going to correct in the future. We're no longer going to ask people to pick a race. We're going to ask people to identify who they think they are and what they feel, and we're going to go from there. And I think that's the right way to move forward. There's a lot of questions here. Thank you for your talk. This is from Dr. Ippolito. What are some cultural nuances that you see between the different Hispanic communities? You mentioned that it was important when we encounter patients in a medical setting. You kind of answered that, and
But I will also add, if I may, there are differences not only in the dialect, but differences in the words and how they're used amongst different. When we look at Mexican, Puerto Rican, Cuban, Dominican, the words are not necessarily interchangeable, but also the experiences. So those are things that I believe are just as important. And the only way that we can do that is by getting to know the individuals that we serve, and really making sure that the representation is there for those individuals as well. That's important to me. And as Dr. Olivares just said, there are people that identify as Puerto Rican that don't speak Spanish. I am Puerto Rican. I grew up in the South Bronx. I didn't grow up in Puerto Rico. I went to Puerto Rico for the first time at 19 years old. And trust me, that was a culture shock for me. So there are differences, and the more that we understand those differences, and the more that we leverage the resources from those individuals, the more that we're going to be better prepared to really serve those individuals. And I'll leave it at that.
thank you. For Norma Holland, what's one thing we can all do today to make our patients feel more welcome and understood?
Great question, Norma, and hi, by the way. I honestly, for me, it comes down to genuine, authentic caring. That analogy that I made earlier about opening the door with a cup of coffee and a smile, I think that we could all do that in our own respective ways without having the actual cup of coffee. But if you do, even better. But I think that's the authenticity, the genuineness, the love, the compassion, and that empathy, I think is step number one, in my humble opinion.
Question up there.
Sorry about that. I am a Spanish interpreter. Thank you for your lecture. And, we really need to see those nuances when we are speaking, when we are interpreting, like, for example, China, Revulon, things that you from Puerto Rico say, I am from Venezuela, and we don't understand it. So imagine other things that have that impact on health, right? Because those are simple words that you can ask the patient, they can clarify, and you can come up with, okay, this is naranja, this is an orange. So it's simple. But sometimes in Puerto Rico or in any country, they can give you an explanation of symptoms that are not the same in Venezuela, in Mexico, in Puerto Rico, in Chile, in other countries. So it's really a question of clarifying for the interpreter and using the interpreters, as a tool to communicate, between the healthcare professional and your patients. And that is important, to feel valued as a patient, like they are taking into consideration that there are differences. It's not only a question of Spanish-speaking country. Thank you.
No, absolutely. And thank you for sharing that. I mean, I couldn't have said it any better. And coming from you who actually works in this field, it holds so much weight. So thank you for not only acknowledging that, but respecting that as well. And one thing I want to say real quick too is, if we look at a prescription bottle, let's say you have a prescription bottle in your hand and you're looking at it and it says, take 4 of these pills once daily. Okay? Most of us know that means once a day, you're going to take 4 of those pills. Now, you do something as simple as not know English. In Spanish, ONCE is once, the number 11. So now I am someone who didn't have the information. I look at the pill bottle and it says 4 times once. That's 44 pills. One will say, well, you should know better than take 44 pills. But guess what? Some individuals wouldn't know any better. What if that 1 times 11? So that small thing could have such a major impact on a person's life.
I'm going to have one last question
Go
from
ahead.
Dr. Eric Kane. Peer community health connectors are being trained in Rochester, funded by the city. Do you foresee that they will work in the North Clinton area?
Oh, yes, absolutely. As long as we are helping shape that. And if this is the same Dr. Kane from the RAISE report that I worked on, great to hear from you. But yes, absolutely. But we have to be at the table that is creating these processes and that are putting together these initiatives. Because if we are not invited or not part of that table and just an afterthought, I think that we're going to definitely drop the ball. So we have to make sure, and I know that the city is working towards that. I know for a fact the coalitions and Ibero-American Action League and all of our community partners are really making sure that we're not being told what is going to happen, that we are actually able to impact what is happening in our community. So thank you for that, Dr. Kane.
Very good. I have one last question from Linda Gillis. She said, can you come up, do you have any strategies? Oh, sorry. Do you have any strategies if someone declines interpreter services, but you feel they would benefit from that service?
I think once again, the strategy I always go to is come from a place of love, come from a place of understanding, not frustration. I think sometimes what ends up happening is that individuals will say, no, I don't want an interpreter, not because they really don't want it, but because they don't understand the reasoning behind it or how impactful it could be to the overall care that they're receiving. But if me as an individual, I speak to them from a place of love, the way that I would speak to my own children, the way that I would speak to my own elderly parents, I think a lot of times that's going to help to really impact whether or not that individual does ultimately go that route. But we always want to come from a place of understanding, a place of love, a place of just genuine caring, because that's what we all do. So for me, that's always the most crucial and important thing, regardless of everything else. That, I think, to me, supersedes that smile. That's the universal language. I don't care what culture you're in, what language you speak, where you come from. A smile is known throughout the entire world, regardless of what language you speak. So thank you.
Well, thank you very much for this presentation, Julio, and for coming to be with us today. Thank you.
Thank you, and thank you all. Thank you.